All right, so as we talk about disease, we are going to pay attention to a couple key sort of indicators called signs and symptoms. So we want to define those terms and figure out how to use them. So signs and symptoms are, again, sort of warning signals of disease. They're things that we can observe or people can report that can help us figure out what they might be infected with. So in general, I think in society, when we talk about someone being sick and what we can observe about them or what they're experiencing, we just generally refer to those as symptoms. But symptoms isn't the right term in microbiology class. So as we discuss disease, we're going to be more specific, and we're going to break this general category of symptoms apart into signs and symptoms. All right? Again, so warning signals of disease. So how is a sign different from a symptom? So a sign is any sort of objective evidence that the disease is infecting a person. So objective evidence means that me, maybe as a doctor, if I look at a patient or if I sort of inspect a patient, maybe measure things about a patient, I can observe that a sign is present. So for example, maybe the most obvious one would be a fever, right? As a doctor, I can use a thermometer and I can measure to see if a patient has a fever. The patient doesn't need to tell me that they have a fever. I can objectively observe that for myself. And so that makes fever a sign. So signs are anything that an outside observer can look at or measure and see or detect about a patient. So what's a symptom then? Symptoms are more subjective evidence of disease. So these are things that are sensed by the patient, right? So if a sign is something I can measure, right? A fever, I can put a thermometer in a patient and measure their temperature. A symptom that is related might be something like a hot or a cold flash, right? So if I feel hot or if I feel chills, that would be something that is a symptom. My temperature might not actually be different, but I'm sensing my environment in this sort of heightened way, right? I'm too hot or I'm too cold. So again, a symptom is something that the patient experiences or feels and reports to medical professionals. Signs are things that medical professionals can directly observe or measure. So again, that's pretty different than how we usually just talk about symptoms, right? What are the symptoms of a disease? And we list all sorts of things, right? But really here we want to break things apart into signs and symptoms. So let's just look at a few more examples before we end this quick topic. So signs and symptoms. Again, signs are things that can be observed or measured. So a fever. Septicemia. So septicemia is just the presence of microbes in the blood. We can take a blood sample, we can put it under the microscope, and we can see those microbes there. Microbes in other tissue fluids, right? Chest sounds, we can use a stethoscope and listen to the breathing noises of a patient, and we can tell if there's fluid in the lungs. We can see like skin lesions and so on. So there's a bunch of examples of signs here. We also have examples of symptoms. Again, chills. I feel cold. My temperature might not be decreased, but I can feel cold, right? We've got things like pains, aches, soreness, right? If my muscles are sore, you can't look at that or measure that, but I can tell you that that's what I'm experiencing. Malaise and fatigue, right? I just generally feel tired or awful. Those are great examples of symptoms. Things people are experiencing but can't be directly observed or measured. So I'll leave it there with those examples, and we'll continue our discussion in additional videos. As always, if you have any questions, let me know in the discussion board, and I'll talk to you all very soon.